first thing you have to remember is that everybody has an emotional response to a crisis. And it's normal for people to have emotional responses. The range of them are going to change. I mean, people are going to have, depending on their life experience and their socioeconomic status and the availability of resources, they're going to react a little differently. But the range could be just about anything. I think whenever you have a natural disaster like this one is, the first thing that comes to mind is fear and anxiety. And fear and anxiety is a very common reaction. The other thing is sadness. And the reason people have those kind of reactions is because they're unsure of what's going to happen. Some of the fears may be unfounded fears, of contracting the disease, or, we've had staff even say this, people are always looking at us and saying, we may have the disorder. What can we do about that? So they're going to feel helpless, and they're going to mistake common symptoms for chronic health problems. And the chronic health problems are going to reinterpret as part of COVID-19. So all those things are sort of wrapped up. And just the stress from constantly monitoring. Coping mechanisms, there's a lot of very simple things we can do, and sometimes they're obvious, but one is stop watching TV all the time and stay off the cable news networks. I was home on one Saturday, and I got so fed up with it, I just said, my cable was out yesterday for a little bit in the town I live in. Thank God. It was a whole different thing. My wife had actually had a conversation with me. We weren't focused on the television. So that's one good thing to do. The second thing is to recognize that to cope at home, have healthy relationships. Recognize that you are upset. Recognize that there are concerns that you have to deal with. And deal with that constructively together. Make sure you take some time for yourself. When you're home with your kids all the time, if you have a spouse or a significant other, let them take care of it a little bit and you take care of yourself. The biggest fighter of anxiety is to decrease things that are being unsure. So make yourself more sure of what you have. Stick with one source. Stick with your local health department for information. Stick with your locality to gather information on how you cope with the disease. Do what they tell you to do, because people feel out of control, anxious when they're out of control. So get some control back. Do the things you're supposed to do. Establish a routine. If most of us around this table have had our routines disrupted a great deal, and we feel better if we have a routine, if we do the same thing at the same time. The same thing happens with kids. If you have kids, establish the routine, keep the routine up, have some fun with them. I think Nancy said this on one roundtable before. It's physical distancing, not social distancing. Make sure that you have an opportunity to link socially. If you have kids at a distance or grandchildren at a distance, do video conferencing with them, email them. Lord knows, just pick up the telephone and talk to them. And that makes a lot of difference to me when my grandkids call me and my sons call me as well. So that kind of thing is a simple, easy thing to do. Some of the reactions, people start abusing more substances in times like this. So if you need to monitor yourself, ask yourself, are you acting normally for yourself? Are you eating, sleeping differently? Are you abusing substances? Are you drinking more? Those kinds of things. And if you are, seek some help, and we can provide some help with that.
A lot of great suggestions there.
Thank you.